28,471 new COVID-19 cases today. The first time in the week, the daily tally falls below 30,000. Health Secretary Francisco Duque said the rate of infection is slowing down, but the country is still at high risk. Majority of the infections are mild and moderate, which can be treated at home. Experimental drugs are now also available to reduce the risk of hospitalization and death. Joining us now are the importance of these life-saving medicines, Medethix, which is bringing in Molnupiravir and Biocare Lifesciences, the exclusive importer and distributor of Bexovid, the first generic version of Pfizer's Paxlovid. Mona Lisa, Dilip, thank you so much for joining us on The Final Word. Mona Lisa, let's start off with you. Medethix has imported so far how many Molnupiravir pills?
We had imported around 34,000 treatment courses. And as we had promised in the interview, we rolled out in November.
And Mona Lisa, Molnupiravir has not been approved to be sold commercially. So under FDA rules, where is this anti-COVID-19 pill available?
If we're going to base on the distributor health procurement, any program that they possibly do, and then healthcare facilities. Then
All right, we're experiencing some communication issues with Mona Lisa. Let's cross over now to Dilip. Dilip, thank you so much for joining us. You are importing the world's first generic drug of Pfizer's Paxlovid into the country. How many of these life-saving medicines are expected to arrive?
Thanks a lot, Rico. We're expecting to bring approximately 20 to 30,000 boxes initially, which will be coming probably by first week of February in the Philippines.
And with the FDA's compassionate special permit for the generic version, Bexovid, tell us, Dilip, who will be allowed to purchase and use this anti-COVID-19 pill?
Rico, this is the drug which is especially recommended for outpatient. This is not recommended for the inpatient, just like remdesivir or tocilizumab. So this will be primarily available for all the primary, secondary, and tertiary hospitals. So FDA Philippines has allowed for only institutional use. So any person who is infected, who is contracted COVID-19, and his RT-PCR already positive, so he can just take a prescription from the doctor. He can buy from any hospital where the stock would be available.
And Mona Lisa, the Food and Drug Administration is warning the public against buying Molnupiravir from illicit sellers. Are you aware that it is now being illegally sold on digital platforms and online?
Actually, I am not really aware of that. But then there are, as we base our review of the distribution of this product, we also from other companies. See if those products was able to get the CSP approved by our FDA or an.
Because, Mona Lisa, the illegal selling of Molnupiravir has become quite rampant, especially during this time of Omicron, no? And it is sold at a premium, at a much higher price. For the benefit of our viewers, how much is each pill sold for?
As we had our pricing, it ranges between 4,500 to 6,000. That depends on the location where it has to be distributed or given, like the transportation cost, the storage condition of these forwarders. So it ranges between that price. Remember, Rico had given just between 130 to 150. We really can't that range of.
So basically 4,500 to 6,000 for the full complement of pills that will basically get an individual who has mild symptoms of COVID get well. Dilip, tell us, what will be the price of each Paxlovid or Bexovid, the generic drug? How much will it be sold for?
Actually, in the hospitals, it would be available very soon. Probably the patient will be getting approximately 22 to 25,000 probably for the whole treatment. See, Rico, this medicine cost approximately 50,000 probably in the US. So our company is planning to bring this medicine at least 50 to 60% cheaper in the Philippines, so that all our Filipino people can afford this medicine and they can probably get a proper treatment.
Is there a possibility, Dilip, that the Bexovid will eventually be manufactured here in the Philippines, so the cost could come down significantly?
Probably this can be done because the Pfizer has to provide the license then to local companies here to manufacture the product here locally. But that, as of now, I think it still is going to take time, because by the time you develop the formula and produce and take the validation report of the batches, it will take quite a while. Probably it will take 3 or 4 months, probably.
All right. That at least it's sooner rather than later, no, Dilip? And one local manufacturer, Mona Lisa, Lloyd Laboratories, got the green light to manufacture Molnupiravir here in the country. Will Medethix also plan to produce its own Molnupiravir in the country soon as well?
Yeah, Rico, during the last interview we shared to you, seriously considering the local manufacturing. But whatever product now Rico that is available, so the science
And Dilip, briefly before we end this discussion, Canada has already given the green light for at-home use of Paxlovid. Do you also expect that to happen soon in the Philippines?
Yeah, as of now, the Philippines FDA has already allowed, because this is a take-home medicine. This is outpatient medicine. This is not recommended strictly for the patient who are already admitted in the hospital. So technically, anybody who is infected by COVID-19 or who is RT-PCR test positive, he can buy the medicine from the hospital pharmacy. He can take home. He can go home and he can have the entire prescription. So there is no recommendation as of now in the hospital. So yes, definitely FDA already has allowed it for the take-home medicine.
All right. You are the importers of Bexovid. And I was just talking earlier to Mona Lisa that it is the Molnupiravir is now being sold illegally through different channels here in the country. How do you plan to protect Bexovid from being sold illegally?
See, Rico, this is not the first COVID-19 drug that we are carrying. Just to update, our Biocare is the first company who got even the first generic Remdesivir in the Philippines. And we have distributed this drug over the 390 hospitals in the Philippines. Our company was the only, also the company who got the first generic of Favipiravir. We know it by the name Avigan in the Philippines. And even the tocilizumab, which I am sure you have heard of, the tocilizumab being sold at a very, very high rate, in the Philippines as well. So we got this product as well. And we made sure that this product should go always to the right channel. So as FDA has allowed to distribute only to the hospital, so we are not giving to any customer directly. We get thousands of messages over a Facebook Messenger, or my team gets it, but we strictly say we cannot provide to any direct patients. It is only allowed for institutional use, and only hospital can buy it. That's it.
Dilip Tiwari of Biocare Life Sciences and Mona Lisa Salian of Medethix. Thank you so much for joining us on The Final Word.